Alors, un dossier, mais pourquoi? D'abord, vous devez savoir que c'est une obligation légale.
Now, we're talking about record keeping, the patient's file. This is a legal obligation. It's not a requirement from the order nor the inspection committee. This is a provision stated in the Civil Code of the Province of Quebec and also in the Privacy Act and also in the regulation concerning the professional services in the acupuncture office. The patient's file serves as a judicial protection element. Let's say that you are being charged of some accusations from the syndic's office, or you're facing the disciplinary committee. You must know that the patient's file will help you for your defense. If your record keeping is not done correctly, your chances of being properly advised, legally speaking, will be reduced. The patient file shows the steps and approach of the practitioner. This will allow the justification for your intervention.
Ça expose le jugement et la démarche clinique. Alors,
the patient shows that it is an indispensable tool for your practice. It is the reflection of your know-how. It reflects your judgment and clinical approach. It allows yourself or any other person reading the file to follow the evolution of the patient through your clinical approach. It ensures also the follow-up. The more you document what you do, the more you can give appropriate care and good continuity. The patient's file is also a management tool so that you can elaborate your clinical approach and proceed according to the expectations. The patient's file is also a document for quality control of your clinical practice. Now, the patient's chart and versus relevant information. It is a provision under Article 37 of the Civil Code that a file must include the relevant information and the person who is constituting the document cannot divulge these informations without the consent of the patient or without legal authorization. Under Article 5 of the Act respecting the protection of personal information in the private sector, the person that gathers personal information in order to constitute a file on another person must only gather the information relevant to the object of the file. And for us, an acupuncturist must constitute a file and keep a record of any person who's consulting. This is Article 2. We're still following up on record keeping. The acupuncturist must constitute a file for every patient. You cannot have a folder with all family members inside. It's one file per patient. You must indicate all the information required by law. Also, the files must be complete, that the storage, the time of retention of the file, and the destruction of the files are complying with the legal obligations, that the management of the files comply with the rules concerning confidentiality, and finally, if other practitioners are involved, the acupuncturist must sign for every treatment. If you are alone in your office, you don't have to sign the file. Now, since we're in the computer age, using information technologies, many acupuncturists are now using their smartphones for scheduling or other functions. And these smartphones have certain features like internet access, email, text messages, and so on. So these phones contain now more information or confidential information, and that can involve you or your patient in certain cases. Some personal informations and some confidential informations that are under professional secrecy. Just the fact that somebody else knows you have an appointment with John Doe, this is confidential information, so you have to protect that data at all times. It is primal to ensure the protection. Make sure that you have a safe password also. 1234 is not a really good and safe password. We suggest that you can choose a short sentence. And with this sentence, you can select the first letter of each word of the sentence for your password. So it will be harder to figure out for any other onlooker. Also, I suggest that you read the Information Technology Guide from the Quebec Lawyers Bar. You take a look on their website, Quebec Lawyers Bar, and you'll find a lot of informations. There are 23 frequently asked questions, and they are very useful in that matter. If you already use information technologies or if you have the intention of using them.
Les dossiers informatisés, puisque rien ne doit être interprété comme excluant.
Also, for electronic record keeping, we cannot exclude the use of computers nowadays, but some precautions must be taken. An increasing number of acupuncturists want to have their records kept electronically or in a cloud. We cannot use a Microsoft Word document and just make corrections randomly. It doesn't work this way. You need to have specific software that enables you to integrate certain documents where some informations that are entered cannot be deleted. And also, we said that you have to consider the use of an individual password, 8 letters and numbers, or a sentence, like we said earlier. Things concerning a screensaver, the antivirus software, the firewall, a separate backup copy on another unit, and we suggest that you do not use the family computer. If you use a family computer for your files, it's not very appropriate. And here is a useful warning for internet hosting sites like iCloud. You know that information travels freely sometimes. For instance, if the server is located in another country, what happens is they have other laws that apply. The protection of personal information and confidentiality rules can be different. It is your responsibility to know where your records are kept and make sure that it will be done in accordance with the laws in Quebec. The informations written in the database cannot be deleted. And there are other informations through that, but remember that absolute safety and security does not exist. If you do everything you can to ensure safety, and you write affirmations and it describes everything you do, you will have less problem defending yourself in case of litigation. Confidentiality is a fundamental right. This right belongs to the patient, and the duty of protecting this confidentiality belongs to the professional. when we say the word professional, it means an individual who's a member of a professional order. I told you earlier that there are around 50 trades and professions, but there are only 46 professional orders. Some professions were merged into a unique corporation, like we had 3 different types of accountants, and also in this matter the physical rehab therapists were included into the Quebec College of Physiotherapists.
Pour ce qui est de la propriété du dossier, bien évidemment, le support, le papier, tout ça, ça appartient au professionnel.
Concerning the ownership of the patient's file, the folder and the paper sheets that contain the patient's information belong to the professional, but the content belongs to the patient. There was a famous case in a court of law, and this case is named McInerney versus McDonald in 1992, and it made the situation very clear. The ownership of the folder and the sheet for the professional and the content for the patient. So, get to remember that the file should only contain relevant information. Things like social insurance number, the name of the person who referred to you, the occupation of the partner, the blood type, or the marital status are not relevant. Here we have a test for you. And quote, because he is suspecting a certain John Doe of abusing the system, a workers' compensation board agent is asking you if this patient told you about his wife who might be sick, because the agent wants to have more information on this patient who seems to take a long time to recuperate. Unquote. What should you answer? There are 3 things you must consider. First, the content of the file. Second, the clinical approach. Third, the methods of drafting and writing. Here, this is another slide with another test. Let's say you're an inspector. The slide shows the name, address, occupation, and referral of the patient. The chief complaint is shoulder bursitis. The patient's family doctor name is blank. Medication is Lipitor and Tylenol. Energetical evolution and first treatment is dated May 9th, 2013, and says, quote, intense pain, left shoulder since accident, chi blockage, unquote. So, as required under Article 2 of the Regulation on Office Management and Record Keeping of Acupuncturists, the content of the file includes the day of the treatment, patient's identification, chief complaint, clinical observations, energetical evaluation with the wording of Oriental Energetical Medicine, the indications of the treatment, the acupuncture points, the number of needles inserted, the number of needles retrieved, the kind and gauge and brand of needles, the kind of devices that you have used, the kind of technique you have used, the good reactions and the adverse effects of the treatment, the known medical diagnosis, summaries of other professional visits, documents relevant to the patient's illness, legal authorizations, any other documents such as recommendations, modalities, or particular agreements. Does that mean that during a consultation we have to be able to find all these if needed? The file is not necessarily for your own use, but any other person has to read it. So, as we saw earlier, the dates of the treatment, the patient's ID, first name, family name, gender, date of birth, address, phone number. And here's a slide that shows an example. If you make appointments with email correspondence, you can ask for these informations, or if the patient is physically unable, a curator has to sign and write down the information. The provincial health insurance plan number is only needed for workers' compensation and automobile insurance cases. The content of the file must we must know that about the chief complaint, describing briefly the reasons for consultation, clinical observations, collect subjective and objective data,
L'opinion, ben, ça doit être
signs and symptoms, and by questioning and examination of the patient.
énergétique orientale. Il s'agira de nommer
The opinion
le ou les
must be
symptômes
written with the terms
en
we
lien
use
avec la
in
raison de
Oriental
consultation
energetical medicine.
et de nommer le ou les
State the name
symptômes
of
en
the
lien avec le
syndromes
terrain.
related to the chief complaint.
L'indication de
State the
traitement.
name of
Alors,
the
on
syndromes
demande de
related to
définir
the terrain.
l'orientation thérapeutique à court terme et à
Indications
moyen terme.
of the treatment.
On va rentrer dans les détails un petit peu plus tard.
And describe
Pour
the
ce qui est de
therapeutical
l'utilisation
orientation
des
on the
points,
short
alors,
and
vous
long
avez
term.
deux choix, c'est la nomenclature internationale.
Concerning
Par
the
exemple, vous,
identification of the acupuncture points, you have two choices. Either the international classification, for example, your needle long one, you can write LU1. For governing vessel, you can write GV, or with the pinyin writing. So for long one, you will write Chongfu. For governing vessel, you'll write Du Mai. And that's what it's recognized worldwide. You have to count the number of needles you have inserted and the number of needles you retrieve for every treatment. Let's say you see a patient for a second treatment and you do the same treatment. So you write same. It does not necessarily include the number of needles. It has to be indicated for every treatment. The type of needles or devices that you have used during the treatment, and also the different techniques you have used for needles, the length of needles, the stimulation methods, such as tonifications, dispersion, or harmonization. For the electric devices, like electrostimulators, write down the frequency, the poles, and the points that are stimulated. For laser use, the class of laser, the power output, the frequency, and the duration of stimulation. You also have to write down the description of the good reactions or adverse effects. You will be able then to evaluate and justify the changes in your point choice. If there's any incident like a bruise, you have to document that. For medical diagnosis, take note of the prescription drugs and over-the-counter medication, and specifically corticosteroids and blood thinners. For these two last drugs, you have to make a separate checkbox for them. You need not only one checkbox. We must know if you asked the question, if the patient takes corticosteroids or blood thinners. Because if there's only one checkbox, we can suppose that you have not asked the question. Makes a big difference. And then for tuberculosis carriers, the same goes as you need to have a yes or no to be checked in a checkbox. You must have documents of medical examination report, if any. Take note of any appointments with the physician. Was there any changes in the medication since the first treatment? Any other appointments with another professional? All of these must be written down in the patient's file. It helps you to properly follow the evolution of your patient. Concerning the documents pertaining to your patient's illness, examination reports, analysis reports, incident reports, new prescription, and so forth. Make sure that when the patient gives you a copy of one of these documents, you have to sign and put the date and your initials. Also, you can have documents like legal authorization, like a third-party request for the content or part of the content of the file. We're back here with the protection of personal information. The consent to communicate or to grant access to a personal information must be an obvious and informed one. This consent is only given for a specific purpose. This consent is allowed only for the time necessary to execute the purpose of the request, meaning the duration of the acupuncture care. Everything we are proposing here take into account all of these parameters. We didn't make them up, This is under Article 14 of the Quebec's Act respecting the protection of personal information in the private sector. It says that the consent is valid if manifest and well informed, and only for the necessary duration of care. We evaluate that a 6-month period is normal. After this delay, you must have another form to be filled in and signed. For this consent form, everything has been sent. Patient's identification, full name and address, date of birth, gender, phone number, and so on. The disclosure form for acupuncture treatments to another acupuncturist, including his or her name and the license number. Disclosure to another health professional. Do not forget that the professional must be a member of a professional order. You cannot use this form for referral to a massage therapist, an osteopath, or homeopath. They are not regulated yet, at least. They must be professional, regulated by law. On this form, the identification of the person able to consent, if the patient is under 14 years of age, one of the parents must sign. The ID of the acting acupuncturist, the one who opened the patient's file, authorization to disclose information on another acupuncturist, you have to identify, or to any other health professional for an opinion, advice, or transfer. There's a special section for other professionals. The content of the file shall also include any other document, like recommendations, modalities, or particular agreements. On this matter, there is a decision dating back November 2014. A physician forgot to include all relevant documents to a patient's file. You must know that this is also applicable to us or any other profession. We are regulated by laws that are common to all professionals. And the judgment says that the physician was found guilty of failing on record keeping by forgetting to include the information gathered during interrogation and or examination. It is inconceivable to find so few details, and on top of that, the handwriting is so bad that only the accused can read it. We must remind the readers that the file is not only drafted for the physician, so consequently, it has to be readable by any other professional. So, the sanctions are a 5-month temporary striking from the roll, a fine of $1,000, and a partial payment of administrative fees. All this because he had a very poorly developed record of patients. Here's a slide, here's another test, and it quotes, "Your brother-in-law is consulting you for an acute lumbar pain. During the constitution of the record, what kind of information can you forget to write in the file?" There are 3 lines to answer, they're in blank. Ça commence à parler? Now we will be talking about the clinical approach. The source of this document is the polygram of the clinical competence of the acupuncturist that you will find on the order's website. It is in the documentation tab, and it is very exhaustive. We're talking about data collection, symptoms, pain, poor digestion, and so forth. The chronology of the illness, since when, how, eating habits, life habits. You need to structure your interrogation according to the principal complaints. because the detailed description of the symptoms, the medical background, and related conditions will provide the guidelines to help the acupuncturist in his or her clinical judgment. Seek any information on all the bodily functions. To summarize, it is the history of the patient's illness that must be documented, well organized, and elaborated in a sequence that considers the signs and symptoms of the patient. Here we're talking about like the patient is telling the story. Concerning objective data, it's the physical examination. It represents an aspect of our practice that allows to highlight all the relevant signs that are visible, palpable, or measurable concerning the chief complaint. If you take blood pressure, it is included in this objective data section. When we say visible, palpable, measurable, like tender points, mobility, stance, the speech, breathing, pulse, examination of the tongue, emotional state, and so forth. Now, for the interpretation of the data, the acupuncturist must select them according to diagnostic models of the Oriental energetical medicine. The acupuncturist must integrate the data from Western medical sources also and employ a rigorous analysis process. For the opinion of the acupuncturist, we must draw it by relying on the recognized rules of our profession, specify our opinion regarding the nature of the patient's disease with the help of a clinical reasoning process, strengthened by the analysis of all the data that was collected. When we can explain what we did, we're on the right track. For planning the treatment, determine the indications of the treatment, meaning the therapeutical orientation to be taken after analysis, in accordance with the opinion that was mentioned. What we see sometimes in the record, in the file, is either the opinion or the orientation. The acupuncturist, will tell us, oh, well, it's obvious that here there's a Qi deficiency, so I will tonify the Qi. But the thing is that you need to indicate both opinion and orientation. It helps to determine the treatment plan, whether you use acupuncture, herbs, Qigong, or Tui Na. Choosing the treatment method that complies with the regulation of acupuncture practice. Of course, those methods shall be recognized. The acupuncturist must adopt a watchful conduct in order to avoid any harm. The acupuncturist must localize the acupuncture points in a respectful way. For example, if you have the needle near the pubic bone, inform the patient that you will go there, or ask the patient to lower their clothes a little bit. You will use the needles properly and also use any other instrument shall be indicated in the chart. For example, cupping or moxa or TDP lamp and so forth. Concerning the follow-up now, you must have an update. The date of the treatment must be written, have a complete and precise update of the chart. Ask the patient about the outcome of the previous treatment, the reactions, or any new information that can influence the treatment. We expect from you that you ask questions to your patient. How he or she feels, how was your sleep after the treatment, things like that. We have to indicate this in the chart, because these informations can change your choice of points. We also have to write down the signs that show energetical changes, adjust the treatment plan if needed. Also, indicate another time the orientation of the treatment. Write down the points, number of needles that you've inserted and retrieved, the kind of needles, the instruments you have used, the kind of technique. The summary also of phone calls, if any, or advice that you give to your patient. Everything you do must be documented in the chart. According to the evaluation of the follow-up, the acupuncturist shall proceed with the treatment or refer the patient to another professional if needed or stop the treatment. Everything's fine. Here we have an example of a patient's file saying that a new patient has a mother-in-law who is seeing an acupuncturist. The reason for consulting is to balance the energies in general. The patient says that he suffers from bunions, has a few headaches once or twice a year, has a little problem falling asleep during new moons, and some urinary problems. The opinions is disturbed Shan, and the points are PC6, heart 3, large intestine 11, stomach 36, liver 3, spleen 6, kidney 3, and Renmai 17. As you can see here, there's a lot of information missing in this chart. Now that you are an experienced acupuncturist regarding record keeping, you are able to state the missing information. The content and frequency of the transcript must allow to follow the evolution of the patient, evaluate the efficiency of the treatment, and to justify any change in the orientation. I said earlier that we can write same treatment if you do the same treatment as the previous, but we do not want to see same for 10 treatments in a row. It would not be very good. We expect that sometimes to see some changes in the treatment sequence. Otherwise, we could not really praise on your treatments. We expect some changes in the evolution of the patient, or we'll have to reevaluate your patient. Things have to change. The patient feels better or worse, it has to be written down. Notice that what is not written in the chart is presumed not been said or done. I saw some acupuncturists told us, well, everything is in my head, in spite of the fact that he sees 30 or 40 patients a week. Everything is in their heads, so I don't really believe this. Now, concerning incomplete files, you saw earlier an example from the College of Physicians. The doctor was charged with a fine of $10,000 and got reprimands for failing to document the evolution of many patients. So this has to be taken seriously. The method for record keeping that I just talked about comes from the competence polygram of the acupuncturist. There are also other methods for record keeping. The conventional method depends on the environment you're working in. Got the case history, subjective examination, information analysis, treatment indication, treatment plan, or you follow up on the reactions of the previous treatment and so on. There's also the SOAPIE method, the SOAPI, being the acronym for subjective, objective, analysis, plan, intervention, evolution, like the physiotherapists do. The completion, the content, and frequency of the transcript for every treatment must be sufficient to follow the evolution of the patient. And remember that the chart is elaborated in order for another person to read it. The handwriting must be readable to avoid any misunderstanding of interpretation. Because if a chart is not readable, it is useless, as if the chart would not exist. A professional can engage his civil liability if it is proven that he has worked with an incomplete file. You must know that some acupuncturists have been charged with similar problems concerning record keeping. And you can read also those convictions from the syndic's office in the Order's newsletter. Some particularities concerning the transcript: the language, the precision, using the right acronyms. By the way, there's a list at the end of the record-keeping guide for acupuncturists. The completeness, the readability, And now, concerning mistakes in writing some information in the chart, they must be deleted with a line across and your initials next to it. The use of liquid paper is not recommended, but it is tolerated for minor mistakes. And of course, the transcript must be permanent and indelible. We cannot modify handwritten notes. They must be as undeletable as if they were kept electronically. Concerning confidentiality, the length of retention and the destruction of the patient's file, they are regulated by specific rules that the acupuncturist must know. The files must be kept in the office.
Un dossier manuscrit, ça doit être aussi indélébile qu'un dossier informatisé. Pour le mode de conservation, la destruction des dossiers font l'objet de règles spécifiques que l'acupuncteur doit connaître. Les dossiers doivent être conservés au domicile professionnel de l'acupuncteur.